Thank you, Tom, and good afternoon, everyone. I apologize for being a bit late. Before we begin, I'd like to update you on an upcoming change to our reporting. Over the past 16 months, it has been a privilege as Chief Medical Officer of Health to provide more than 230 updates to media and the public. We have been through a lot together, and while COVID-19 will be with us for some time, cases are falling quickly and vaccine uptake is rising. We are entering a new phase in our fight against this virus. That's why, to give our hardworking data teams a break, we will not be reporting cases and vaccine numbers on weekends any longer. We will continue posting detailed data every weekday. This is in line with the approach that BC and others have taken for quite some time. We will also be shifting our R-value reports to 2-week intervals. With cases so low, this will give a more accurate picture of how COVID is spreading. Finally, next Tuesday, June 29th, will be my last regularly scheduled media availability. After that, we will shift to providing live updates when needed. These availabilities are intended to provide critical information, and the reality is that we're making great progress. All of our public health efforts will keep going. Contact tracing, testing, and other important work continues day in and day out. But in addition to COVID-19, there are other health issues that also need our time and attention. Turning to today's update, over the last 24 hours, we have identified 57 new cases of COVID-19 and completed about 5,000 tests. Our positivity rate was about 1.4%. We have identified 38 additional variant cases in the last 24 hours. There are currently active alerts or outbreaks in 207 schools, representing 9% of the schools in the province. Our hospitalizations continue to decline, and there are 200 people being treated for COVID-19 in hospital, including 54 in the ICU. There are now 1,773 active cases, the fewest since October 2nd. Our numbers are declining quickly, which is a testament to the power of vaccines and the way Albertans are all helping protect each other. Sadly, I must announce that one new death was reported to Alberta Health in the last 24 hours. My thoughts go to the family and friends of this individual and anyone who has lost a loved one in this pandemic, whatever the cause. It has been a long year, and I know that many people continue to grieve the loved ones they have lost. If you know someone in this position, I encourage you to reach out to them, to let them know that they are not alone. We continue to need each other's support in many ways during this time of transition. We have now administered more than 3.85 million doses of COVID-19 vaccine in our province. This includes more than 45,000 yesterday alone. Right now, 70.8% of eligible Albertans have been vaccinated with at least one dose, and 30.4% are now fully immunized. I know some Albertans continue to wonder whether they need to get the same brand of mRNA vaccine for first and second doses. To be clear, you do not. Pfizer and Moderna vaccines can be used interchangeably. It does not matter which brand you get for your second dose. They are both safe and effective, and it is perfectly okay to get one dose of each. Our own Alberta data is clear about why it's such a good thing that our Moderna shipments have increased so much this month. Our data show that over the past 6 months, Moderna has had the highest effectiveness of all vaccines with 93% protection against infection after a second dose. Pfizer follows close behind with 90% protection. Both vaccines are highly effective at protecting against infection and severe outcomes. Taking the first vaccine that is available to you is the best way to protect your health and the health of those around you by developing stronger immunity as soon as possible. First dose appointments are also still available across the province. There is still time, so go online or get on the phone and book your appointment today. As I mentioned earlier, vaccines are enabling us to soon enter a new phase in the pandemic. Some anxiety and uncertainty is natural during these transitions. As cases drop and vaccinations rise, we all must get ready to face a new kind of challenge. Learning to live with COVID as restrictions ease and life starts to feel closer to the one we knew before COVID-19 arrived. For the past 16 months, we've lived with a wide range of mandatory measures designed to stop the spread of COVID-19 and safeguard our healthcare system from being overwhelmed. These restrictions varied and evolved, but they were firm rules regarding what to do and what not to do. Now, as most restrictions will soon be easing, we need to learn how to live with this virus without these rules. This means entering a time with less mandatory barriers on what we can do, while still being thoughtful about how we manage risks. We are up for this challenge and we can make this change, but we need to start practicing now. There was a steep learning curve and a period of adjustment when the pandemic first began, and this will happen again. It will be critical in the next few months, especially as we continue to increase second dose coverage, that we support each other to manage risks in ways that make sense for the context and risk factors that people have. As we find our way back into activities that are newly allowed, it is important to remember that precautions like avoiding crowded indoor areas or wearing a mask remain reasonable choices for those who have risk factors for severe outcomes or for those who haven't yet gotten their second dose. It also means moving at the pace that's right for you. If you're not ready to do something or want to take extra precautions, that's perfectly okay. And if all of us can approach others with compassion in this time of transition, it will make a critical difference in the coming weeks and months. In addition, it will always remain vital that all of us continue good habits that can help us long after COVID-19 has been tamed, like washing our hands regularly and avoiding being around others if we feel sick. Of course, even though provincial health orders will change when we enter stage 3, there will still be some rules in place. Isolation requirements for confirmed cases of COVID-19, quarantine measures for close contacts who are not fully immunized, and protective measures in continuing care settings will remain. And while the general indoor provincial mask mandate will be lifted, masking will still be required in limited and specific settings. Today, I can confirm that when stage 3 begins, we will maintain masking for continuing care and acute care settings. We are in discussions with regulated health professionals about the precautions that will continue to be prudent in community health settings as well, particularly until everyone has had the opportunity to receive a second dose of vaccine. Masking will also still be required in public transit, taxis, and ride-sharing, given the closed indoor environment of these spaces, and to protect those who have not been able to be fully vaccinated yet. We will continue to monitor these settings carefully and will lift masking requirements once it is safe to do so. Particularly in continuing care settings where a heavy burden of both illness and isolation has been felt over this past year, I know there are questions about why restrictions remain in place even after stage 3 begins. These settings, while diverse, are the places where some of our highest risk neighbors and family members live. It is important that we hear from those who live in these settings and who care for people who live there about their risk tolerance and wishes for a balance between COVID protection and enabling more activities before final decisions are made. So watch for information about an upcoming town hall series to get input from residents, family members, and operators on the way forward. It's important to know that we are all going to have conflicting and different emotions and varying reactions in the coming weeks, and this is okay. As we have through the entire pandemic, I encourage all of us to continue being kind and respectful as we adjust. And finally, as I've said before, the greatest act of kindness you can give yourself, your friends, and your neighbours, as well as the health of this province we all call home, is to choose to join the circle of protection that vaccine offers. So please get vaccinated, both first and second doses, as soon as you can. The more people who get vaccinated, the safer we will all be in the weeks and months ahead. Thank you, and I'm happy to take questions.
All right, we have a very full queue. We'll try and get through as many as possible. We will begin with those in the room. Julia.
Hi, Dr. Hinshaw. Good to see you in person again. The Premier last week said that he doesn't see a scenario for moving back in the reopening plan. But doctors say we shouldn't be fixed to plan since so much can change with this virus, and there continue to be concerns with the Delta variant. Are you completely on board with the reopening plan? And what, if anything, such as R values, Delta variant numbers, hospitalizations, could pause or slow down reopening?
It's an important question, and of course we continue to monitor the Delta variant as well as vaccination coverage as we look at the reopening. One of the most important things when my team was planning the reopening was considering the impacts not only of COVID-19, but the impacts that the restrictions have had. And as we look at the impacts that vaccination has had on minimizing the risk of severe outcomes like hospitalization, it's really important to weigh all of those things together as we consider, as we're going forward and monitoring, whether or not adjustments need to be made. At the current time, what we know from places like England that have seen a surge in this B1617 or Delta variant is that even though their cases have risen, mostly in unimmunized individuals, their hospitalizations have not risen as dramatically, and the majority of those who are needing hospital care are those who are not immunized. And so I think, again, it's really important as we're looking at the measures that we have relied on throughout this pandemic, such as the R value, the new case numbers, and our percent positivity. Those are all representations of case growth. And case growth matters most if it ends up feeding into spikes in hospitalization and ICU, and of course, tragically, those who pass away. But if case counts don't lead in the same way to severe outcomes, then we should not respond in the same way that we previously have to case counts alone. And so what we'll be watching, of course, is transmission trends, looking at vaccine effectiveness, as well as really focusing on the risks of severe outcomes. But we have an extremely high level of protection across multiple age groups across the province. We will continue to work very hard to expand that protection and work with Albertans to do so. But again, we're going to need to look at our case numbers in a different way going forward, given that vaccines provide us with this really welcome relief from the severe outcomes, which are the most concerning parts of COVID-19.
Julia, is there a follow-up?
Yes, thank you. Edmonton City Council is discussing its mask bylaw today. Calgary has extended its until July 5th. Now, I know that you were just talking about learning to live with COVID and this transition that we're going to be making with vaccinations. When July 1st rolls around, will you continue to wear your mask in public settings?
I'll just say I'm sorry for not looking at you while I answer. It feels awkward. But certainly, as I said, masking remains a very reasonable choice for people to make, and it's going to be really important as we move forward into stage 3 for people to give each other the space that they need to navigate how they want to manage those risks. I was just reading a report earlier this week about individuals who have chronic respiratory conditions like asthma, and how the wearing of masks has actually dropped severe outcomes for those individuals even beyond COVID-19 prevention, and how some people may want to continue wearing masks even beyond, again, the COVID-19 experience, because for some people it has been a really effective way of mitigating a risk that they have, not just from COVID-19, but from other respiratory infections. So in terms of my own personal choices, I am glad to say I do have my second dose of vaccine now, but I won't yet be 2 weeks post that second dose on July 1st. So I will likely be certainly waiting at least until that point in time before I choose to remove my mask. And of course, in settings of high risk, as the ones I mentioned earlier, it's important that everyone continue to support the health of those who may be at high risk of severe outcomes by continuing to choose to wear masks.
All right, we'll go to the next question in the room here. It's Lauren Boothby from the Edmonton Journal.
Hi, Dr. Hinshaw. How are plans going on the national vaccine passports for international travel? And is Alberta going to have its own version for, say, if we need to look at government services or businesses asking people to prove that they're vaccinated locally as well as internationally?
Thank you for the question. In Alberta, we will not have a provincial vaccine passport. So it will not be a requirement for individuals who want to access government services or services in this particular province from a public policy perspective. I haven't been directly involved in the detailed discussions of the technical aspects of how we're connecting with the federal government on their work internationally. But of course, if Albertans wish to travel and if they should wish to take advantage of whatever program the federal government puts in place, we would not stand in their way. And right now we are providing people, when they get their vaccine, they would get a paper record of the vaccination, and then they would also have access to My Health Records, where they could pull that official record of vaccination at any point in the future. And so again, the technical details of what that would look like and how people would be able to access if the federal government does go down that road, those things are forthcoming, and of course we would not stand in the way if Albertans wish to take advantage of that.
Follow-up question, Lauren?
Yeah. Some people who have had COVID and recovered might think that they don't need to get a vaccine because they might have some kind of immunity already. So what kind of immunity do they have, and are there any plans for maybe them getting like serology testing or something for people who got COVID before? So are these people going to be included in the national vaccine passports at all in some way?
I don't know whether or not the federal government will be including post-infection considerations in their national app. That would be a question for them. With respect to vaccine recommendations, the National Advisory Committee on Immunization continues to recommend that individuals who have had infection with COVID-19 continue to to choose to get the extra protection that a vaccine offers. I know that in some countries they have chosen to go with a single dose of vaccine as a booster after someone's had an infection. But so far in Canada, we are not experiencing a vaccine shortage at this time. That was one of the reasons why some countries chose to offer only a single dose, was as a vaccine sparing strategy. And so I continue to recommend that people who have had infection, while they may have some measure of protection following that, they will have even better protection if they choose to receive a vaccine. And in fact, there is some interesting research that indicates that if someone's had infection, say with the previously dominant strain of COVID-19, and they get a vaccine, that combination actually provides them with greater protection even against variants if they have that dual enhancement of immunity. And finally, just to say that getting a vaccine is a much lower risk way of accessing protection than getting an infection, where people have all of the associated risks of potential severe outcomes.
All right, we'll go to the phone now. Operator, could you put through the next caller, please?
Matt Woodman, CTV.
Hi, Dr. Hinshaw. If we see hospitalization numbers or perhaps the R value increase after we lift all the restrictions on July 1st, is there a backup plan in place, or is the province strictly taking a kind of wait-and-see approach with how things go?
So I just want to distinguish those two metrics that you talked about, because one, the R value really does talk only about cases and case growth, and the hospitalization metric is, of course, the severe outcomes that we most want to avoid. We will, of course, be watching very closely, and if there should be a change or a significant impact happening within our acute care system, then, of course, we would need to consider adjustments to the plan. But I want to go over the evidence that we currently have available to us with respect to the likelihood of surges in severe outcomes. Again, we know from places like the UK, where they have had experience with the most recent variant of concern, the B1617, that while there is less protection from a single dose of vaccine against infection, there remains there's still a very high level of protection against severe outcomes like hospitalizations, even from that first dose, and even better with the second. So as I said earlier, we're sitting at just over 50 new cases today, just over 1,700 active cases across the entire province, while we're sitting over 70% first dose and over 30% second dose protection. We have hundreds of thousands of vaccines arriving in the province every week, and people are eager to get their second doses, and we're still having uptake in first doses. So given the data that we've seen on the protective impact of vaccines, given our significant volumes of vaccines coming in and the high demand, the likelihood that we would see a surge in infections of any of the known variants of concern that go on to cause a surge in hospitalizations is extremely low. And the other really encouraging thing about all of the vaccines and all of the variants that we've seen so far is even when a variant of concern may be able to evade the immune system's protection against infection, the vaccines always consistently perform better at preventing severe outcomes, even if a new variant so far, to date, has been able to still infect individuals. We will remain, of course, very closely monitoring the situation, continuing to watch how this unfolds. And of course, if there are those who live in a community where that particular community has a very low coverage, we could have localized outbreaks, but the risk to the provincial health system of becoming overwhelmed, I believe that the current vaccination coverage is a game changer for our ability to protect the health system.
Matt, is there a follow-up question?
Yeah, I know some other healthcare professionals are worried about a potential fourth wave in the fall. Has the province put together any modeling yet, looking at, where it could potentially be headed?
We, as we always do, look at different scenarios, and in terms of forward planning, making sure that we're ready for different scenarios. The difficulty of doing any kind of predictive work that would be 6 months out from where we're currently sitting is there's just so much uncertainty in between now and then. I think it is likely that we will see an increase in cases at some point. Again, what I think is less likely is that those cases will go on to cause significant surges in hospitalization. And when I talked earlier about the need for all of us to consider how we're managing our risk, it's also important for people to know that none of the vaccines that we have are 100% effective. So there will continue to be, unfortunately, a small number of people who end up with an infection, and an even smaller number of people who end up needing hospital care or unfortunately even dying. But that number is much, much, much smaller. And we need to consider how we're managing our risks of COVID-19 similar to how we manage other risks like influenza. Even something as simple as getting in a car and driving carries risk with it. And so the more we're able to look at the activities that we do with that broader picture of risk, I think that will help us as we move forward into the fall. And from a system perspective, we're of course going to be monitoring if there's any new variants emerging, the need for booster doses as we continue to monitor the duration of effectiveness of vaccine, and we will be continuing to update recommendations based on that evidence as it evolves.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Rick Bell, Calgary Sun.
Good afternoon, Doctor. And I'd like to thank you for all of the very informative live updates you've given, and all of the very thorough answers to the many, many, many questions I've asked and many others have asked. So thank you for that. A question of follow-up. What is your reaction to Calgary City Council's decision to continue with their mandatory mask bylaw beyond July 1st, and not necessarily getting rid of it July 5th? They could continue with it well into the month of July. We don't know that, potentially to the end of July. So what is your reaction to that, given that you have recommended a different course of action?
It's certainly, again, for individuals, can be a reasonable approach for people to take to want to continue to use masks as part of the way that they're navigating their own risks. From a municipal perspective, certainly municipalities retain the ability to set local rules for their particular context. I think when we look at the entire province, the decisions that have been made and the recommendations that I've put forward are really based on looking at our current epidemiology with respect to the lower number of cases. They're based on looking at the high and increasing levels of protection of vaccine. And as you heard earlier today, looking at the locations where people who are at the highest risk of severe outcomes, or locations in that kind of closed indoor space like public transit where people need to use that service and may not have had a chance to get a second dose. So the recommendations that have been put forward really are based on protecting people in those very either high risk or high risk of transmission environments. But as a broad measure, again, across the entire province, I think that it is reasonable to shift into an approach where we allow people to make decisions about what works best for them. And from a municipal perspective, perhaps that same thing applies, where municipalities are looking at the spread in their community, perhaps the levels of support of their own citizens. I can't comment on the reasons why Calgary might have chosen that. But again, they take that local context into account, and the provincial context is what has informed the recommendations that I've made.
Rick, is there a follow-up question?
Yes. At the debate yesterday, there were, members of Calgary City Council who obviously are not in agreement with the province's plans, and it sounded like what they thought was the province was going too quickly, particularly in the removal of masks. And in one case, the person even used the word reckless. And at the same time, they had a doctor, not an expert in public health or infectious diseases, but a doctor who suggested that actually to keep the masks until well into August. So what do you say to those people who want to continue the mandatory masking, for several weeks, and think you're going too quickly?
As I mentioned earlier, we've had these rules in place for 16 months, and I think when that's the case, and the rules, really, it's only a couple of weeks ago that we entered stage 2, and stage 3 is coming now next week. I think it's understandable that for some people, that shift from in early June, what was very restrictive, to the beginning of July, really easing all mandatory measures except for some of those high-risk locations. It is a really significant transition, so it's understandable why people would feel like we're moving very quickly. But again, I think it's important that as people are considering the framework that's being put in place, that they understand the game-changing nature of vaccines, and that it's not just about, obviously we want them to prevent transmission, and I think the reason why some people are really focused on the next month or so is that we haven't finished giving second doses to everyone. And so again, it's important to support people who are using masks in that time period, and that's very reasonable. And so that may be, again, why some of those recommendations are focused on that time frame. But if we step back and look at the big picture about how the vaccines have shifted, not just from a transmission perspective, but from a severe outcome perspective, again, that's the basis of the recommendations that I have made and the shift that we're talking about. But there is still risk, of course. And so needing to make sure that people are aware of that and that they're managing their risk. And again, that may happen at individual or perhaps even in this case at a municipal level as they're trying to make decisions about this time period where we haven't yet finished giving second doses to everyone who wants one.
Operator, could you put through our second last caller, please?
Carrie Tate, Globe and Mail.
Hi, Dr. Hinshaw. Thank you for taking my question. I'm wondering about the vaccination rate in rural parts of the province, particularly where we have higher portions of the population that are Indigenous or living in Hutterite colonies. We can see that only 62% of people in Alberta, eligible Albertans outside of Calgary and Edmonton, are vaccinated. What are you doing to reach those communities?
I first want to make really clear that there is a diversity of perspectives across the entire province, and in no way are either Hutterite communities or Indigenous communities homogenous or universally low in terms of immunization coverage. So certainly we are looking at ways to engage. As you say, there is a disparity between the coverage rates in Edmonton, Calgary, and then the rest of the province. So we're looking at ways to engage with the communities who are experiencing lower immunization rates to understand what those barriers are. And we've heard a variety of things, certainly with our increasing supply of vaccine coming in with the higher and higher amounts of Moderna. Some of the suggestions that we've heard are that there's, in some places, been a concern about availability of vaccines. So we're making sure that providers in those communities know that they can order as much vaccine as they want to be able to provide doses to all those who want it. And we're working very closely with different stakeholder groups. I have regular conversations with First Nations chiefs, with the Métis Nation of Alberta, the Métis Settlements General Council to understand what the interests and needs are. And again, there's a diversity of experiences in many of those locations where some have extremely high immunization coverage, others have lower, just like in other communities across the province. So we are working on a variety of supports, whether that be logistics, whether that be information provision, working with local healthcare providers to ensure that they're connected and able to provide information to people who may want to hear it from a source that's closer to home. And all of those things are, again, in play right now.
Carrie, is there a follow-up question?
Yeah, I'm wondering, are you finding that those strategies are successful?
What we see, and again, this isn't unique to any one particular community, but what we see is that the majority of Albertans want to be immunized. And we're seeing that when we open up eligibility categories, there's an initial rush of people who want to take the opportunity to access protection that the vaccine offers to them and those around them. And then there's another group that they're willing to be immunized, but it's not their number one priority. So working to make sure that we understand how to make it easier for people to access the vaccine, how to make sure that when they do want to go get the vaccine, it's available for them in an easy way. Those are the kinds of things that we're doing. And so, yes, it's working. It's just that does take a little bit longer than the first initial rush of all of those who are very keen. And so we're working on that, and we are seeing progress. But again, the numbers just take a little bit longer to gain because each individual or each group will have a slightly different need. And so working through those specifics isn't going to be as fast as offering the vaccine to those who are very keen and have the resources and ability to get to their appointments and make those appointments in a timely way.
Operator, could you put through our final caller, please?
Bill Fortier, CTV.
Hi, Dr. Hinshaw. Welcome back. A similar question to the last one, but I'd like to widen it out a little bit. Alberta's first dose vaccination rate is still among the lowest in Canada. You said 70.8 today, so that's only up 0.1% from yesterday. So we've essentially plateaued, and we've plateaued much lower than any health expert thinks we should get. How concerning is that for you that we're not going up very quickly and we're only around 70%? And you know, you've already addressed this, but what more can be done?
Certainly, it's clear that the more people who have the protection of vaccine, the better off we will all be collectively. And as I mentioned, there are different reasons why people haven't yet come forward to get a vaccine. And so right now we're doing that slow and methodical work to find out what those reasons are, how to make sure that we're providing accurate information in a way that's accessible to people, how to make sure we're identifying where barriers exist. And we will be continuing to work at that throughout the summer. So it's really important for people to know that vaccine is something, again, that as we're building that protective level, we don't stop at 70%. We will continue to find out what those reasons are that people haven't yet come forward. And again, there's a diversity of those, and we will continue to make gains, even though it may be slower. Throughout the summer, this will continue to be a goal and a topic of work.
Bill, is there a follow-up question?
Yeah, quick one. You talk about figuring out why people aren't getting the vaccine, but you know why a lot of people aren't, and it's misinformation, and there's a lot of it out there. So, the question is, the Premier keeps pointing people to the website, the Alberta website for information, but when you look at the misinformation that's out there currently, the Alberta website is not keeping up. You're not finding answers to questions about lipid polymer nanoparticles and spike proteins, and that's what the bad actors who are presenting misinformation are presenting to people. So my question is, do you have someone in your department who's monitoring the misinformation and then dealing with it? So countering that misinformation with real information. And if not, why not?
This is a current priority, actually, which is to ensure that we are accelerating our identification of some of the misinformation faster than we previously have been, and being able to respond to it in a variety of ways. So this is something that, again, we have been working on throughout the pandemic, but we are seeing a need to really focus on that particular area. And I want to emphasize that it's not just that it's important to make sure that our website remains up to date and a source of truth, particularly where there are new pieces of misinformation that spring up and proliferate. And again, we're working on that. But we're also working to try to partner with local healthcare providers, with different organizations, because often people will trust people who they know, who are part of their daily lives. And so making sure that we give people that opportunity to hear reliable information, not just from our website, but also from others who may be more likely to be well received. And so again, that's work that's underway, has been for a while, but sometimes it just takes a while to kind of set all of those specifics to make it as easy as possible for local providers to be able to do that outreach. And those are the kinds of things that we're working on right now, because we know it's critical that people do have access to reliable information in a variety of ways, including from local trusted sources.
Thank you all for joining us. Dr. Hinshaw will provide another update Tuesday of next week. Have a safe evening.